5-factor model, also known as the hot cross bun model, is a simple foundational element of cognitive behavioural therapy, or CBT. This model enables you to develop an awareness of how your environment, thoughts, emotions, physical sensations and behaviour all influence each other. In fact, they are so closely connected, changes in any of these areas can lead to changes in the others. Let's look at an example. Julie has health anxiety. She spends a lot of time worrying that she's ill, which has a big impact on her life. Julie's health anxiety started 2 years ago when her mum died suddenly of a heart attack. One day, while going for a hike, Julie notices her heart is beating quickly, her mouth is dry and she is sweating. Julie has the thought, "I'm having a heart attack." Julie feels anxious and fearful and calls the emergency services. The essence of this model is that it's not the situation that causes us to feel a certain way, rather it's our interpretation that impacts how we feel and behave. Looking at Julie's background, we can see she was diagnosed with health anxiety. Over the last 2 years, Julie has had a multitude of private health checks, including MRI scans, ECGs, blood tests and so forth. All of her tests have come back clear. She has a healthy heart, and as she's hiking, her heart rate has increased. Rather than interpret this as, "I'm hiking, so my heart rate has increased and it's a hot day, so I need to drink more," Julie has jumped to the worst possible conclusion that she's having a heart attack. As Julie waits for the ambulance to arrive, she has another thought. "The ambulance is not going to arrive, I'm going to die alone." Julie experiences a rapid and shallow breathing pattern and she starts to feel dizzy. This reinforces the thought, "I'm going to die," and leads to feelings of dread and fear. Julie calls the emergency services again. Julie's thought that she is going to die intensified her physical reactions and induced a full-blown panic attack. The 5-part model reflects a constant interaction between our environment, behaviours, thoughts, emotions and physical sensations. Changes in one area can lead to changes in the others. Via the process of therapy, Julie learned to identify how she gets stuck in unhelpful cycles and how these cycles can be reinforced. Julie learned that her physical sensations are due to anxiety and panic. So next time she experienced unpleasant physical sensations, she told herself, "I'm okay, this is just anxiety. This is what anxiety feels like." So the change in how Julie thinks about her physical sensations change her behaviours. This time, Julie sits quietly in a safe place and conducts a breathing exercise which keeps her calm. The act of making a small change in one area influences all other areas. Let's look at another example of the 5-factor model. Patrick lost his job last year and at 60 years old he's struggling to find another role. He's tired most of the time and struggles sleeping. He has a lack of interest in doing things and has cut himself off from family and friends. Patrick feels depressed and has thoughts of, "I'm a failure and my life is hopeless." Patrick has negative thoughts centred on themes of negativity, low self-esteem and uselessness, which is typical of depression. He's also involved in retreating behaviours as he's cut himself off from family and friends, and he also has a lack of interest in doing things that he previously enjoyed. He is withdrawn from the world and isolated himself, which reinforces his low mood and negative thoughts. Via the process of mapping out his experiences using the 5-factor model, we can start to hypothesise about the causes, precipitants and maintaining influences of his problems. And remember that a small change in one of the areas can lead to positive changes in all areas. Thoughts and behaviours are usually more accessible to change, so for this reason, thoughts and behaviours are often targets of CBT interventions. With depression, we often start by changing behaviour, as this is usually the most effective. So we could start by addressing the retreating behaviour, perhaps encouraging a small change in this area, maybe calling a friend or family member for a catch-up or doing something that he previously enjoyed. It's important that assignments are small, workable and within Patrick's skill level. If the task seems too big, he'll not complete it, which in turn can reinforce the thought, I'm a failure. So we do have to be careful. If successful with this task, we can move on to activity scheduling, in which he plans each day in advance and creates manageable steps to help him overcome his retreating behaviours and ultimately improve his mood. Alternatively, we could work directly with Patrick's thoughts via specific CBT interventions, such as a thought record, which will teach Patrick how to examine and challenge his thoughts and ultimately reframe them. CBT aims to teach clients to be their own therapist by helping them understand their current ways of thinking and behaving, and by equipping them with the tools to change their thinking, emotions and behavioural patterns. So via a collaborative relationship between the therapist and clients, we help clients define problems and gain skills in managing these problems. Now, there are a lot of targeted CBT interventions which are actually the topics of other videos. So please subscribe if you haven't already done so and press the bell notification so you'll be informed when I release a new video. I look forward to seeing you soon.